The Veteran Lived Experience series features personal conversations with veterans who have agreed to share their story on topics prevalent in the veteran community. Veterans are joined in discussion by professional experts and members of the Veterans Health and Wellness Foundation team.
Good afternoon and welcome everyone to the Veterans Health and Wellness Foundation's Veterans Lived Experience series event. This is brought to you by the foundation. And my name is Dr. Evelyn Lewis, and I'm your host, and I also serve as president and chairman of the foundation. The foundation itself is a nonprofit 501(c)(3) charitable entity, and it was established by military veterans with expertise in the area of health, wellness, and healthcare delivery, and where that intersects with what we call social determinants of health, or issues like employment, housing, food shortages, et cetera, and military culture. What we do is embodied in our mission, which is to build, educate, maintain resource networks that support the complex physical, social, and emotional needs of our veterans in their communities around and across our nation. Our vision seeks to expand communities that possess the knowledge and capacity not only to identify and address service-related health challenges, but also to embrace, support, and empower veterans and their families who experience those challenges. Bottom line up top, for every veterans, or for all of the veterans and their families to be their best selves, our foundation strives to expand opportunities for them to live healthy and well lives, undiminished by their service-related health concerns. So for those of you who've registered and joined us, today's topic is the battle for love and intimate relationships. Well, we will dive into the chronic illness and injury concepts, if you will, that impact intimacy and intimate relationships among those who have incurred chronic illness or injuries. My guests today are Dr. Mitchell Tepper, a sexuality educator and counselor living with spinal cord injury, whose mission is to serve individuals who are struggling to understand sexual response and expression post-injury or illness. Also joining us today is Mr. Timothy Hornick. He's a medically retired Army officer and the director of special initiatives at the Blinded Veterans Association, the only congressionally chartered entity, a veteran service organization that's tasked with supporting America's blind and visually impaired veterans. So right now, what I'm going to do is turn it over to Dr. Tepper and Mr. Hornick to share with you more about themselves and their experiences. And then we'll dive deeper into the conversation with some questions. Dr. Tepper.
Thank you. Thank you for having me here today. As mentioned, I am a person with a spinal cord injury, and I think acquiring an injury at the age of 20 while working as a lifeguard is what brought me eventually into the field of sexual health. First, I was exploring my own sexuality and trying to adapt to some of the challenges that I had after sustaining a spinal cord injury, which led me to leave my, well, I was in school, but I started a career in finance, but made my way to public health, where I got a master's in public health and started to study sexuality education and counseling in spinal cord injury rehab programs. And then that interest and that response spurred me on to getting a PhD in human sexuality education with a focus on sexuality and disability. And for 15 years, I ran a website called sexualhealth.com, and I was helping people find, information on sex and disability at the click of a mouse. So in 1996, that was novel. My work expanded from just people with spinal cord injuries to other disabilities. So there's many things that could be learned by studying sexuality in people with spinal cord injuries, because we have a loss in genital function, we have a loss in mobility, we have sometimes an increase in pain, we have incontinence, we have body image issues. So there's a lot to be learned by studying spinal cord injury, and that brought me into other areas, and then eventually into working with all types of wounded and injured veterans. And then personally, I got married after my injury. I was told at the time of my injury I couldn't have a child, but I learned that was possible, and actually achieved that at home with fibrostimulation and at home insemination. And I'm married now, 36 years. So
Thank you for that. And now, Mr. Hornick, if you would give us a little bit more information on who you are and what your experience is and has been.
Well, thank you very much, Dr. Lewis and Dr. Tepper, for having me on board. As you stated with my brief introductory, I'm an individual that has lost their sight as a result of combat operations in Iraq going back to November 11, 2004. And since then, I've had a rather roller coaster series of adventures as I've gotten used to life with a visual impairment that has, well, sometimes been maladaptive, other times been quite instrumental to who I've become today. So going with that maladaptive piece is that after I had my visual impairment, I stayed on active duty for about 7 years, where I tried my best to be a sighted blind guy, which is quite difficult in the military, especially with the military culture where if you have a disability, you're considered broke. So I had that negative self-image going for myself for a number of years that definitely had a negative impact with my relationships, especially those with my wife, family, and friends during that period, until I started to awaken to myself and I identify who I was as an individual and start to accept myself as a individual with a disability. And I did that as I was going for my master's in social work, where I really looked at that time period in my life as being that transformative piece that allowed me not to be just resilient, but more importantly, transilient, which is when you go beyond who you were before to create a new you. And since then, I've focused a lot of my own personal readings and growth, as well as discussions with other veterans and individuals with disabilities, looking at that piece of their lives on where they are at that time when they had their injury, where it is that they wish to go, and where do they think they can go, looking at all those as different aspects of that recovery process. And also looking at individual identities and spirituality throughout that process. And so with this presentation today, you'll definitely hear from Dr. Tepper as well as myself that it is during those early periods that things are rather fraught with some difficulties, especially as we talk about intimacy and trust, that in my case, I didn't like myself. So how am I supposed to like others is a great way for me to summarize that. But I just want to say thank you, Dr. Lewis and Dr. Tepper, for having me on board, and we'll go.
Well, thank you for that too, Mr. Hornick. We're from what I understood, Dr. Tepper wanted to share a video with us that sort of speaks to this very topic. And so while I attempt to get that on board here so that we can see it, one question for you, Mr. Hornick, and that is sort of after you sustained this injury and were able to sort of digest really what had happened, what was your medical care like? How did you feel it was adequate? Did you feel that it met your needs? What was that experience like? Because that's really where we'd like to hone in to some degree as we begin to expand on how these chronic illnesses and injuries impact intimacy.
So that's a very good question, because I'm going to divide that up into two segments: the mental health care versus the physical health care. The physical health care was fantastic, where the optometrists, ophthalmologists, and other folks that did their best to get me all back together in one piece and all, they did a fantastic job. They tried their best to restore whatever it is that they could that I lost from my injuries. But when we look at that physical health piece, they're just trying to put you back together physically. That psychological and cognitive piece, that's where I'll say there's a lot of gaps, just because when I had my injury, especially which remained there on active duty, I was not ready to see myself as a blind person. I want to see myself as a sighted person, stay in the military, being a hard charger. So whenever I spoke with my social workers and counselors during that period, I put on this fantastic face where I covered and concealed what was inside me, to the point that I had a lot of my social workers and counselors saying, you know, you're a good poster boy for what's going on. You're showing these good attributes of resilience, given that you're able to maintain your place in the military, that you're able to do what we want someone to do, which is, you know, maintain employment, maintain family situations, all that part, because I did not want to show them this other part of me. And with that process, that's why I'll say there were some gaps. No one was able to identify that because I wasn't ready to let them know what was going on inside me.
Well, thank you again. You seem to sort of come to the place where we talk about quite frequently in regard to what is missing from the healthcare arena in regard to those who are suffering from these conditions. What I'm going to do now is share my screen and see if we can't hear a little bit of that video that Dr. Tepper wanted to share with us. And then we will come back again and get a bit more engaged in the conversation.
I was wounded in the firefight. I was shot 4 times.
I was an explosive ordnance disposal tech, which means I was military bomb squad.
I was married to Aaron 18 months before he was injured.
The physical aspect of me recovering was easy. The therapy, not a problem. But relationships, it was tough because I was my biggest enemy.
There was a lot of unknowns. Daily life can look like, what was dating can look like.
I knew that it wouldn't be normal, but it's not something that ever deterred me from my relationship with Tyler.
The violence that was going on, you know, it was a constant, and it kind of came home with me after that deployment.
I know this isn't my husband. I know that something is wrong.
Over 600,000 veterans are living with PTSD and or traumatic brain
Overwhelming
injury.
feeling of acceptance. Finally, here I was with someone that loved me for who I was.
You gained a sense of humor, a lot of laughs in a bed where you're experimenting.
Winning the battle.
Was nothing attractive, not that you're going to see in any type of Hollywood type movie or anything, but what did it mean to us? A whole lot more than that.
She held our marriage together even when I was unknowingly doing everything I could to end it.
Overcoming the odds.
Something he never thought he could have. And it really means something when somebody says that.
I am so grateful. Every single person that helped him make it out of that battlefield that day.
You could stop it right there. So that was just the trailer for a documentary I directed and produced called Love After War, Saving Love, Saving Lives. And it covers the 5 couples that you were briefly introduced to there, and some commentary by me and some other experts in the field. And we have a couple other clips to share with you if we work out the technology on this side.
Thank you. In the meantime, Dr. Tepper, a few other questions for you, as well as for Mr. Hornick. But what was it that sort of directed you to begin to do the work that you're doing today? Maybe you can tell us a little bit more about, you know, where your injury figured into this, and if it was actually a part of what got you into this area around education and counseling and what have you.
Sure. So I was working at Morehouse School of Medicine. I moved to Atlanta in 2006 to work at the National Center for with Dr. David Satcher in the National Center for Primary Care and the Center for Sexual Health. And I was, you know, hired there because of my expertise in the area of sexuality and disability. And at that point, I was invited to speak at a conference in Orlando, Road to Recovery Conference, to seriously injured service members and veterans. And the people were just very hungry for the information that me and my colleagues were sharing at that conference. And no one had talked to these folks. Some people were newly injured, some people were injured as long as 10 or 11 years, and no one had addressed sexuality with them. And at the time, one of the headlines I remembered was that, quote unquote, failed intimate relationships are the leading cause of suicide. And so in speaking with Dr. Satcher, he thought this was a good area for us as the Center of Excellence for Sexual Health and Responsible Sexual Behavior to look at, and that we might be able to really make a difference in suicide prevention by looking at intimacy issues in the military and in veterans. So that's what brought me in. I was really moved by my interactions with these folks. I felt like I could make a difference. So Dr. Satcher let me do a national conference in 2008 called Wounded Troops and Partners, Supporting Intimate Relationships. And that was held at the Barbara Jordan Conference Center in Washington, D.C. So it was a room where we could invite 100 influential people. So we had people from DOD, VA, veteran service organizations, the Hill, people who could, both private and public, people who could either influence policy or implement programs or potentially fund programs. So we brought these folks together to get this on the radar, and we did. So after that 2008 conference, first I was invited to the VA in Augusta, Charlie Norwood, to help provide technical assistance in developing relationship retreats. And those relationship retreats first won a chaplain's best practice award, and they were in combination with chaplains and social workers, and we incorporated the PEERS curriculum, which is from the PEERS Foundation. And PEERS is an acronym for Practical Applications of Intimate Relationship Skills. So we were running, long weekends, couples retreats, and they were very, very powerful, very, very powerful. And then those have become, they were institutionalized in the VA as the Warrior to Soulmate program. So that was one really strong outcome. Next, I was invited to do staff training at Walter Reed National Military Medical Center, where I trained the folks on the delivery of comprehensive sexual health care for combat wounded veterans. And some of my colleagues that were sex therapists went and trained them in brief counseling and sex therapy. So Walter Reed had created the Sexual Health and Intimacy Work Group, and over the years have integrated sexual health and intimacy into their care delivery service up in DC. So, I was at Morehouse School of Medicine, unfortunately, on what we call soft funding, which, wasn't extended for our program. And I was still very interested in working with veteran populations. And first I was going to write a book based on the transcripts from the event from the 2008 conference we held. And that to me wasn't enough. And then I thought maybe a photo book. And then I came to the conclusion that only video, only a film could really bring across, what these folks are dealing with. And I wanted to show a positive example of folks who were, quote unquote, winning the battle for love, right? To offer some hope, because what we hear in the news mostly is about, failures and divorce and suicide. So, these are, just a handful of stories that people were doing well despite all the different disabilities. And I thought it's very important to share in order to both open up conversations amongst veterans themselves, their romantic partners, and also for caregivers and for health professionals. So, you know, the movie, I'm looking for some corporate underwriting. It's already approved to be distributed through PBS, and it's available through New Day Films for educational distribution. So that's where we're at.
Okay. So you mentioned while you were talking there that there are these what's called Warrior to Soulmate programs that are within the VA. Is that correct?
That's correct.
Are they in all of the VAs or in
No,
certain
so
ones?
they're in certain ones. Unfortunately, before this, I went to check to see where they're offered. So I usually go to a website that's for that the Peers Foundation set up to, you know, tell about Warriors to Soulmate, and that is, let me just click on that right here. It's w2sm.com. So if you go to w2sm.com, you'll see a video about the program, and you'll see information about the program and some resources. Unfortunately, no longer is there a schedule of where it's offered. Last time I checked, it was offered. Then I went to the Peers Foundation, and also, unfortunately, because it used to have a list of where it was offered, it wasn't there. What you need to do, if you're a veteran, is you need to go to your chaplain's office or call your chaplain's office at your VA and ask them. So even if it's not at your VA, I believe there used to be funding to go for you and a partner to a retreat. And then they also added a family component after I was involved, I think. So there's actually retreats, I believe, that your children can go to, and they were offering them, you know, pretty much East Coast, West Coast, a couple times a year. So unfortunately, they're not touching enough people, and not enough people know about it. And one of the things I've been doing when I'm talking about the documentary, I talked with the whole the VA, the Suicide Prevention Division, and they asked me what I was looking for, and I said I'm looking for someplace to refer people to, you know, from the movie. And out of 10 or 11 people I talked to, only 2 of them knew about the Warriors to Soulmate program, and only one was more familiar with it. So it's one of the VA's best kept secret, and hopefully it's still going on. I just couldn't confirm that before this talk.
Sure. A question for you, Mr. Hornick, in regard to Dr. Tepper. How did the two of you come together, meet, and is what he does, is that been helpful to you in terms of the work that you do? And you might talk a little bit about what that is so that people can better understand. But I'm very interested in how the two of you initially connected, and how helpful you found the work that Dr. Tepper does, and how it impacted your ability to move forward.
All right. Thank you, Dr. Lewis. And Dr. Tepper, correct me if I'm wrong, but I believe we met during the 2013 or 2014 Road to Recovery conference, where you were talking about sexuality as well as the pairs related curriculum. Though we didn't do a full out pairs retreat during that conference, there was an introductory period that you did provide to those of us that were in attendance.
Yes, and so I actually had seen Timothy speak on a panel also at the same conference, and took notes, and I'm like, I have to get and I ended up having lunch with him. I have to track him down. And you, me, and Antoinette Izzo, if you remember at the time, had a nice lunch together. And from there we stayed in touch. And when I was doing the documentary, I said, he's got to be in it.
Yeah, no, and It was absolutely fantastic. 'Cause just learning about this type of how do we reconnect with our partners. I've been married to my wife now for 20 years. And I will say that that initial period after my injury, we did that role switch of partners to caregiver to patient. And we had that as the major method which we communicated with each other, aside from everything else that I was tossing at her, which was not a lot of good things. And it wasn't until I started relooking at things to learning more about intimate partner relationships that I began to understand and appreciate that, look, we need to redevelop this relationship. We need to figure out how we incorporate both that caregiver role that my wife was doing, along with what my needs were at that point, along with what both of our needs were for us to be in a marriage, in a relationship together. And so that's where this really bounced out on me. And I was like, this is fantastic. This is something I really love to learn more about and have implemented throughout individuals and practices that are looking at how do we help individuals with disabilities overcome them, because this is a major piece of it. One of the follow-up actions that occurred after Mitch and I met is that we were able to do a pairs retreat on a cruise with the Pairs Foundation, with a group of special operation service members and veterans, and seeing how we were able to use this modality to help these couples come together. It's just one that just resonates strongly with me. I'm saying, hey, this is something that we really need to look at. This is a topic that needs to come back quite often as we go through our lives on how are we maintaining these connections with each other? What do we need to look at? Because life is filled with these types of transitions, not just the occurrence of a disability that causes a transition, but throughout life. So this is just a good topic to come up and think about. It's like, how do you maintain that intimate relationship with your partners, with your families, with whoever that individuals are?
That seems to be a very important piece there. And the other interesting thing that that you said, Dr. Tepper, was that it seems to be a well-kept secret. And to me, that is really a lot of why I am happy that you and Mr. Hornick agreed to have this conversation, because the one thing we don't need is another well-kept secret. One of the things we heard from Timothy when he mentioned, when I asked about his healthcare, he says for the physical piece, he thought it was very, very good, that they met his needs, et cetera, but not for the mental health component. And so that's where we find a lot of the issues today also. We have all of these various programs and initiatives that we have integrated and implemented to decrease veteran suicide. Yet we have this as another mechanism that could potentially help with that, but it remains, as you mentioned, a well-kept secret.
There's an evaluation study, an outcome study on the W2SM website, Warrior Soulmate website, and it says that an analysis found that implementing Warrior Soulmate had a significant positive budget impact, achieving a greater than 30% ROI, which I'm sure a lot of people care about, but through decreased emergency room days, decreased psychological visits, decreased chaplaincy visits, decreased medications, decreased inpatient psychiatric admits, and decreased suicide flags. So for a weekend program that people could go through that has such benefits, it should be available all over, to anyone who needs it. And that's, that's one of my missions, is to make sure programs like this become available, because suicide is really, the worst outcome, but you've got the divorces, but then you have intimate partner violence that happens, and children that get negatively impacted from this, watching this poor behavior between partners. So there's when people get divorced, they often end up homeless, so it adds to the homelessness. People tend to drink more when they have these issues, and substance abuse. So there's all kinds of negative consequences besides suicide that could be averted through taking care of this most core issue for people.
Yes, I agree. There is a short video on the site that you mentioned, w2sm.com, that I also wanted to share with those who are with us today, that will give them a little bit of an idea of what this is all about. And then we'll continue with a little bit more of the discussion once we're done here.
And that's, I mean, it's a great thing. I can't wait to hear one day these marriage enrichment things coming all over the VA. I mean, that's what I would like to see out of this, is these continue to grow.
I mean, as much as it's helped us, I want to see other families, just grow from it. Because if they use the skills that we've learned, it can happen.
Yeah.
It really, really can happen. And I've seen it with some of the other couples too. You know,
They're already changing. Yeah.
yeah, just in the Valentine's Day. Because one couple came in, she did not want to be there. She did not want to come. And by the end, they're like leading in examples and volunteering to do stuff. That was cool to see.
Yeah.
And
That's
they were on the
good.
verge of a divorce too. I mean,
And there's no telling how many couples that are out there right now that are going through that same
but
thing.
it's not just couples. I mean, we went home and I used one of the exercises with our oldest daughter. It's families. I mean,
Right.
we're talking not just us. We have 2 little girls. It's affecting them. They don't understand why daddy's agitated.
They do know to ask me if I've taken my pills,
Yeah, his daddy took his medicine, but
but still,
he's learned to communicate with them in a new level, in a new way that they can understand.
you know, this is why daddy's acting this way. Daddy, you know, is feeling sad, or I'm not upset at you. I'm upset because of feeling this way. And that's why I want to go back to the bed. I just need some time to myself to collect myself, and then we can go and do these things. And they've been supportive. I mean, I have a 10-year-old and an 11-year-old daughter that are just great. They are coming around. They're doing so much better than we are. And I just think there are a lot of other couples that could really benefit from that kind of help.
The word that has come to mind for me is hope.
Yes.
Yeah.
Total hope. There is. I mean, before we got involved with all this, there was no light at the end of the tunnel. You couldn't even see the tunnel ending. And I mean, through his mind, he was going to end it himself. And now, I mean, I think back to 2 years ago for us, we're totally different.
Mm-hmm.
Totally different. He still went through everything he went through in Iraq. I went through everything here. But we've taken that and we've chose to make the best of it. And the skills that we learned are helping us, because it's like, if you don't have the tools, you don't know what to do. It's kind of like being a parent. There's no guidebook, but you know, this helps.
It is it's just frustrating, and this is definitely a way for us to kind of network with other couples that are going through the same things, and for us, we're a little bit further along than some of them in their journey, because some of them are just come back, or some of them are just going through these things, and so some of the things we're able to help them on, and so we're able to help one another. You know, we can call one another and talk to each other. Not just when we're in the class, but away. And so we've gotten a group of friends together that have gone through the same kind of things and going through.
I mean, we can't wait for our meetings, our monthly meetings, and we
look
travel
forward
2 hours to come.
That's the new normal support group.
The new
Right.
normal support,
Follow
yeah.
after the retreats.
We drive
Yeah.
2 hours to get here just to go to these things, and we look forward to it. I mean, we plan our month around it, so we can be
We
here.
do, you know, get the babysitter, do all that good stuff, but it's that important to us.
Yeah, it's worth it.
That video is over 10 years old. So that couple, you know, came to one of the first retreats that they did for well, it was Charlie Norwood, but in South Carolina. And then we were doing sessions, this new normal group and they were doing sessions in, I think it was in the basement of a church or at a church. So they'd have it in the evening with some food, and people could come together to continue to process.
Yes, well, again, listening to that video and hearing and understanding that it's 10 years old, it's very much applicable to the things that we hear and see today. Or is that peer-to-peer group still functioning, do you know, or?
I do not know. I haven't been at the VA in over 10 years.
Do you, through the work that you do, sponsor or host or interact with any peer-to-peer groups that have these types of discussions?
Unfortunately not. I've been trying to stay connected with the Peers Foundation, but they've kind of, their focus is, although they have this and it says they have online training, but I don't see it there. They've been focused more on homelessness over the last many years. So, I keep, I keep talking to people at the VA about, trying to make these things a little bit more accessible, but haven't made that much headway yet.
Mr. Hornick, in regards to these types of support groups, peer-to-peer support groups, have you participated in any, and if so, did you find them valuable, like the couple who was featured in this last video talked about?
Oh yeah, and I think the peer support group is one of the most powerful support groups, actually treatment modality, that we can offer our veterans or other individuals going through these processes, because it's one thing to do the individuals and the couples therapy, but be able to sit with folks that look like you, sound like you, talk like you, figure out some of the similarities and differences you all have and come up with solutions that work for either yourselves or someone else. I mean, it's such an awesome modality to have. I've done this with visual impairments, with blindness, with couples that said did the one retreat several years back. And you just can't ask for a better way of having this type of engagement. I will throw in the little elephant in the room when it comes down to getting re-engaged with the VA and having peer support groups again, COVID. VA, I just came from working for the VA before I started working for the Blind Veteran Association. And I will say that a lot of the peer support groups got quickly transferred over to telehealth modalities, which they do work, not going to deny that one bit, but that face-to-face interaction still has a tremendous value and benefit that telehealth does a good job with, but sometimes you need that face-to-face, especially when you're having these types of conversations where you need that trust to develop that level of agreements with your fellow participants that's needed in this type of treatment.
Do you know of any that are actively happening right now that we might consider putting on the resource sheet that we will share with others who attended and who will listen to this later?
Not that I could come up with top part of my head. Most of them are just going to be based on the individual VA medical centers. Some of the VSOs are beginning to get their own peer support groups up and running. But nothing that I can give you right this moment. But if you give me some time after we're done, I'll be able to find out some.
Okay, that would be great if you would send some additional information around that. I'll add it to the resource sheet that will be available to those who've registered and for those who come and listen to this, the recording afterwards. Again, because we've had this it's not a revelation actually, but a very disappointing acknowledgement that this exists and veterans don't know about it. I mean, until, Dr. Tepper mentioned the website, w2sm.com, I'd never heard of that. And it is still there. It does have various pieces of information there that I think would be helpful to folks who are in need of this type of information. But again, if you don't know that it's there, there's no way that it can help you. And so in terms of thinking about that again, Dr. Tepper, from your perspective, how would people contact you who were experiencing the kinds of issues that we've been talking about thus far today? Or if someone, a caregiver or a spouse or a friend, how would they contact you and see about getting help for the person who's experiencing the types of things that we've been talking about?
So I could be reached either through my personal website, drmitchelltepper.com, and also through loveafterwar.org. So either of those contact forms that go directly to my email box, and I have to, explain to everybody that I am a PhD in human sexuality. So I'm a sexuality educator and I offer coaching services because I'm not a licensed mental health professional. So the whole peers program is an educational program, and specifically, facilitators are just that. I was a trained peers facilitator back in 2010, 11. We're there to teach people the program and to coach them through the program. We're not there to give our advice in solving the problems that we hear that they're working on, right? So, it's amazing how much education and informal counseling and coaching can help, but unfortunately it's not quote unquote valued, as in my services are not covered under insurance because I'm not a psychologist or psychiatrist, and unfortunately I've worked as a research position at the VA for a year, but I wasn't able to implement any programs because there was no way to quote unquote credential me as an educator.
So as you mentioned, that insurances don't necessarily cover
They won't cover my
your
services.
services. Is this a direct pay from those who contact you?
Unfortunately, that's how it would be.
Okay.
Yeah, I mean, I wish I could take insurance.
Mm-hmm. And so in doing so, are there discounts or what have you available for the veteran population that you serve with your services?
Sure,
the reason I'm
I help all of my folks, because I see a lot of people with disabilities on fixed benefits. So I'm very open to sliding scales.
Okay, thank you for that, because one of the things that the foundation does is try to increase in awareness around the different topics and different services that are available to veterans. And in doing so, as you mentioned, we'll come across some like this where insurances are not accepted, or even if you would accept them, they won't pay. So making them aware of what that looks like, if they can get assistance from groups like the Veterans Health and Wellness Foundation or others that could potentially help them cover the cost of getting these services. So that was, thank you very much for letting me know that. And I'm
Yeah,
sure,
I have a very large vision for Love After War. So, it's the idea would be drive people to loveafterwar.org. I'll take loveafterwar.org from what it is right now as just a promotion of the documentary and add all of the resources that I have, not just resources, but parse the information out. I've got a pile full of books here, have them the best information there on the site.
Mhm.
Ideally, the second part would be facilitated groups, as Timothy mentioned, things are going online, to do facilitated support groups, by folks like Timothy and other folks that I'm over the years I've got a half a dozen or more veterans with injuries who are also licensed mental health professionals and either social workers or marriage and family therapists or working towards sex therapy. So I'd love to have a group of folks accessible to facilitate and also to do on the third prong would be really more intensive telemedicine interventions. And of course, I'd love to do, have more physical retreats, around the country. So, and I'll keep going, and hopefully the documentary will draw enough attention that we could draw resources. So it's a huge plan, but that's how I like to spend my time.
Well, thank you for what you're doing and what you're working towards, because as we've discussed here today, it's definitely very much needed. Mr. Hornick, in regard to your credentials and the work that you do you see yourself forming any of these peer groups down the line, or referring folks to different avenues that you're aware of that could be helpful to them? And the reason I'm asking is, again, as I look to put together resources and things that are available to help those with these conditions, I'd like to be able to add that to it.
And Dr. Lewis, I would absolutely love to. That's one of the reasons why I got picked up for my current position, is to start to develop different types of peer support groups. Grant is going to be focused under the Blind Veteran Association at the current time, but it's one that I do wish to branch out and to get more into the areas as a social worker, as someone that just is a huge advocate for these types of resources to get out there and services available. Yes, is a short answer. Right now, so I'm just getting things set up where I'm at, but eventually, yes.
Great. Thank you for that. And when you get that information or more information on the development and how things are working out or shaping up, please forward us some of that information so that we can include it in the information that we send out to veterans and also in our newsletter. I guess I have maybe one or so other questions in regard to what we've been talking about today. When we consider these types of injuries, illnesses, chronic injuries and illnesses, and the impact that they have on one's life, just as the couple mentioned in the video, it's not just a couple. It also includes the family, and that family might be children. It might be, parents that are within the home, caregiver that's within the home, etc. Dr. Tepper, are there, specific pieces of information or peer groups that would benefit those also, versus just those that have been immediately impacted by what we've been talking about today?
The Wounded Warriors program, right? They have these Odyssey retreats, and they have some for couples and they have some for families, I believe. So, and they've been somewhat supportive of the film. They, I got a nice endorsement, and they, shared it over Veterans Day with some of their members, and they have been working towards increasing focus on intimacy issues. So I would say, let's, for families to explore through there. And there are little programs, that do retreats, all over the country. There's small, locally funded programs that do wonderful, things in nature, or outdoors, or activities that bring couples and families together. And so those, I guess we would just have to pull together on a resource list. The Semper Max Fund, they also gave me some money towards my documentary when I was first developing it, and they have a horse farm, right, where they do retreats, and people could go there on a ranch. I believe it's in Virginia. There are some places in Texas that do retreats. So there's a lot of, committed individuals, kind of like me, offering programs. So that's just a matter of searching. So it gets easier when you look at, providing something for the family.
Mhm.
But I think when it comes down to intimacy, because it's so tied to sex and sexuality, that people feel that that's still a taboo topic, And
Yes.
my special contribution is that I talk directly about sex and sexuality and intimacy, So
Yeah, it's interesting that you mentioned that because one of the I sort of think the biggest issues around some of separating this is the difference between sex and intimacy. And sometimes people tend to use those words or think of them as one and the same when they can be very different.
yeah, in a good sense, they come together,
Yes, yes,
and
yes.
then intimacy and emotional intimacy can enhance sex.
Hmm.
I mean, we could call sexual intimacy, but it's not always intimate. I mean, my PhD is in human sexuality, and what's different with humans, is that we bring, you know, culture and emotion, you know,
Hmm.
to sexual activity, into relationships. So animals, they mate based on, hormones and just pure drive. And people can do that too. I mean, people could have sex without intimacy and it could feel good, right?
Hmm.
Um, but long-term lasting relationships and keeping, sexual relationships alive over time, uh, it really helps if there's emotional closeness, in that formula. And a lot of that has to do with developing, which peers helps you do amazingly over a weekend, uh, developing a sense of both vulnerability and empathy. So those, they call it love, the loop of vulnerability and empathy.
Hmm.
And so that those two things are, amazing, that the peers program can help people learn those two things as skills over a weekend. Oh, because when we're not, I mean, Timothy said in his story, right? He wasn't ready to share his pain, his frustrations, his anger with the folks at work, right? At the VA, because he wanted to keep himself in the military, right? So
Hmm.
he was not willing to be vulnerable to say, really, I'm having a lot of struggles here, because vulnerability has risks. In that case, it would be a work-related risk. He might be just discharged. It's amazing, his story, when you hear about it, how he ended up staying in as the first person who's been blind and was able to stay in the military. I believe so. That's right, Timothy. I'm not exaggerating your case here, am I?
No, you're not. There. Yeah. Yeah. No. 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 No.
So yeah, so he's pretty amazing himself. Um, and so, but without vulnerability, no one could help you. So
Hmm.
people could be in a relationship and still feel very lonely. It's amazing. One of the statistics from a new family study, and I shared that with you in a slide, Dr.
Yes,
Lewis.
yes. Hmm.
It was about how many? It was like 54%. It was over half
Yes.
of
Hmm.
people, military families, uh, identified as being lonely, even if they were in a marriage. And the only way we are lonely in a marriage is if we're really not sharing what's going on with our lives. So, I mean, as humans, I believe, and this is where we get to a uh, spiritual perspective, is that we all yearn for connection, and we all yearn to be loved by somebody in a romantic, sexual way. So it's fine to be loved by a brother, a sister, a mother, a child, but it's very different than that most intimate of connections with a romantic partner. So,
Yes.
that's
While I believe education of some sort is at the core of many of the issues that we talk about that impact veterans and their families. This also speaks to that, because as we talk about the difference between intimacy and sex, we can also talk about the differences between being lonely and alone. You know,
right.
we use those terms together and interchangeably, but they are again very different.
Very, very, very different.
And can require different, you know, different resources to help one resolve them. So as we come to the end of this, there is a program that I become somewhat aware of that is at the Walter Reed in Bethesda, but I don't have a lot of details on it. You would have to actually call there to find out what's going on with it, because they've had a number of folks who were part of the staffing for that program transfer. And I don't know that they've fulfilled those roles or refilled those roles yet. So I'm not sure where it stands and if it's still viable at this time or accepting other folks in. But I will say to those who will come and listen to this later, as well as those who are on now, that that is a starting point, particularly if you're in that area. And they may even have a telehealth component to that.
Yeah, so if you call, ask for, see if it initially was called the Sexual Health and Intimacy Work Group. And then it was, I think it still maintained the Sexual Health and Intimacy and maybe a program.
Mhm.
Yeah, I just learned two of the people that were instrumental in that program. Unfortunately, one has retired, one has left. They were both experts in love after war. So I had four or five folks from the Walter Reed Intimacy Group in my documentary.
Mm.
As I said, had the honor of training them, and they were supportive when I was making the documentary. So I actually, one of the MDs is retired too. So three out of those, well, there were five, three out of the five, and I'll have to circle back and see if the other two are there. So it's unfortunately, when it comes to sexual health, it falls down on the priority list in our healthcare system. So this is really, it's a friend of mine thought I was critical of me because it thought I was being negative on the VA, and it's not isolated to the VA. It's because we're talking about veterans here, and we're talking about military folks. Our whole healthcare system has really ignored sexual health from an intimacy perspective. And so this isn't like VA shaming, this is unfortunately, I don't know, a negative consequence of our poor way of dealing with sexuality and sexuality education in general in the United States. So, I'm not here to cast to criticize the organization. I'm here to advocate, and that's what my whole mission has been over the last 35 professional years, is to advocate the provision of comprehensive sexual health care in the rehabilitation process. And that doesn't have to just be medical rehabilitation from injury. Anyone going through a cancer diagnosis is dealing with changes that
Mhm.
affect their sexuality, their sexual health, their intimacy. And so that's why it needs to be in the whole healthcare system, wherever there's serious chronic illness or disability.
Yes. Well, thank you very much. Mr. Hornick, we are sort of at the top of the hour, but I wanted to give you the opportunity to provide any closing remarks that you had and might want to share with everyone.
My main closing remarks are just going to be for folks as you are engaging with individuals with disabilities, especially within the veteran population. to understand that this topic of intimacy is a very strong, very powerful moving topic that can help someone really advance themselves related to their disability. And it's going to come down to being able to have that conversation with them in a safe and welcoming environment, because it is so often underreported, underserved. Use your adjectives to describe it, because it's not happening. It's not happening just to build that relationship with others. It's not happening to help individuals rebuild that relationship with their partners, especially that sexual relationship that often goes undiscussed in other types of rehab models or counseling models. So this is just one of those great topics to look at yourselves, look how you can get involved, sharing the information with the Live After War documentary, getting connected with Dr. Tepper, and just learning more about how we can each come together to serving individuals in a very unique and very powerful manner.
Thank you very much for that. And again, thanks to both of you, Dr. Mitchell Tepper and Mr. Timothy Hornick, for joining me today to discuss this very important topic, and to hopefully increase awareness of those who joined live today and those who will come later to listen to this, and to make themselves available to the resources that we will post along with the tape. Our next Veteran Lived Experience Series event will be in October. We always come on the second Tuesday of the month from 1 to 2 o'clock. The topic next month is inflammatory bowel disease and its impact on the career of a Marine, and how it has shaped his life since that diagnosis. So we'll invite you all to join us then. We'll be putting out the link and what have you to that event. And hopefully we'll have the technical glitches that we experienced today addressed, such that it will flow a lot more smoothly. And I thank Dr. Tepper and Mr. Hornick for their patience with the difficulties that we had today. They were real troopers in terms of continuing to provide us with information, responding to questions and what have you, that I think will be very, very helpful to veterans and their family members, caregivers, et cetera, who are part or who are experiencing the types of illnesses or injuries that we talked about today. So on that note, I'll say thanks to everyone who joined us. I look forward to continuing to have you all as a part of what we do here in our purpose of expanding awareness and sharing of information, so that anyone who is in need of these services that we talk about from month to month can get the help that they need to improve their healthcare outcomes for themselves as individuals, and reduce the impact that it has on their families. So again, Dr. Tepper and Mr. Hornick, thank you very much for joining me today.
Thank you.
All right, you all take care. Have a wonderful rest of the week.
You too. Stay in touch.
We'll do. We'll definitely be in touch. That's for sure. Thank you very much.